Over the last year, St. Peter's Health has been overhauling its operations, working to address a myriad of patient complaints ranging from long wait times to issues with billing. Today, we had the opportunity to sit down with CEO Wade Johnson and see what progress has been made and what still needs to happen. If you've been by St. Peter's since January, you've seen the signs. St. Peter's Hospital is gone, St. Peter's Health is in. But the name change isn't just symbolic. It's part of a multi-year overhaul to company culture and operations that began last July with the installation of new leadership, including current CEO Wade Johnson. Johnson joined St. Peter's and faced a number of obstacles upon arrival.
There were some concerns about, particularly around access to care. So being able to get in to see your family practice physician or being able to get access to a specialist. And then of course the billing. Those were the kind of issues that I heard of.
The new mission for St. Peter's to become the gold standard for healthcare in Montana by 2025. Johnson said that mission can be broken down largely into a couple of components. One of them is listening to the community.
So the big piece of the middle of becoming the gold standard is really developing a level of partnership internally and externally. That allows us to achieve our goals.
Evidence of that partnership, Johnson himself has hosted meetings with the public to update them and listen to feedback. Of course, the other component of the overhaul is more difficult. It requires operational changes to actually improve the services provided so patients aren't sitting for hours in a waiting room, not getting a bill, or getting a bill only to find it's inaccurate.
Look, this is going to take a while to fix. This is not an easy fix.
But there's reason to be optimistic. St. Peter's now bills patients and insurance companies within 15 days, 10 days faster than at the beginning of the year. The goal is to get that number down to 11. And if you're calling for a problem, hold times at call centers are down by 60%, and the vast majority of issues, 90%, are resolved on the first phone call. Johnson says the tools to provide first-rate medical care were there all along.
It was really apparent right off the get-go that we have some extremely talented people. And being able to meet with our physicians and with our nursing staff and other caregivers, I just saw lots and lots of potential.
There's also 15 new doctors at the hospital with plans to hire more. The bottom line for St. Peter's?
Our community now has better access to care than they did a year ago.
To track the progress, St. Peter's has been working with DNV, an independent group that can give them verification that the overhaul is working. St. Peter's is just one of 2 health systems in the state working toward that 4-year accreditation.